All right, audience. Here is a question for this episode. True or false? You have to have. You have to have. Oh, let's do this again. Hey, audience. Here's a question of the day. You don't have to have anything wrong with you to get acupuncture treatment. Is that true or false? The answer will be at the end of the episode. Hey y'all, I hope you're well. Welcome to another episode of Healthcare Boulevard. This is a podcast where we shine more light on healthcare, and our goal here is to provide more options to people looking to choose healthcare as a career path, regardless of their background. My name is Sena Kakpomo, and I am your host and creator here. I thank you for tuning in. I appreciate your support. Remember, you can tune in on YouTube or wherever you get your podcasts. Without further ado, let's get into today's episode. Welcome back, audience. We are here for another interview. I'm here with Nikki today, who is an acupuncturist. I'm very excited to get into it because she's a combination of Chinese medicine and bridging the gap between that and Western medicine. So I'm very excited to hear from her and share her experience with you guys. Nikki, welcome. How you doing?
Oh, I'm so good. Thank you so much for having me on. I'm so excited to chat with you.
I love to hear it. Go ahead and tell us a little bit about yourself.
Okay, so I am a acupuncturist or a Chinese medical practitioner in Minnesota. I have been practicing for 12 years. I have a private practice where I have myself, another associate doctor, an intern, and we are just a fabulously fun, bustling clinic. My clinic is a little bit different than most traditional Chinese medical other clinics. We typically partner and collaborate with Western healthcare professionals. As I went through school, gosh, well, 12 plus years ago,
Mm-hmm.
interesting because we were kind of brought up in the culture that working with Western healthcare professionals was like taboo. Like they were like, no, like we didn't work with them. And when I started my practice, I thought to myself, like, where's all the sick people? They're at the doctor's office,
That's
right?
true. That's the first thing. That's where you're going to find, especially if you're practicing in the Western world, that's where most of us find ourselves whenever we have an itch or a pain or anything.
Yes, yes. And so I started thinking, like, so how I went into Chinese medicine is I really wanted to be an ER doc. My
Mm,
goal, I was just so excited. And then, life happens and children happen. And I realized, gosh, I'm never going to be able to have the schedule for my children that I wanted being an ER doc.
mm-hmm, mm-hmm,
So I thought, okay, gosh, so I kind of took a sabbatical from school. And then I had really bad shoulder pain.
mm,
And I did chiropractic, cortisone shot, physical therapy, massage. I did everything I could. And there was no specific injury. It was an unspecified pain. Couldn't figure out what was going on. So I went to an acupuncturist. And within 2 months, my shoulder pain was gone. I was sleeping better. I wasn't so crabby. It was amazing. So that's when I
mm.
kind of made the shift from Western medicine into Eastern medicine, which then kind of gave me the beautiful collaborative thought of, we're so fortunate we have Western medicine,
Mm-hmm.
and we're so fortunate we have Eastern medicine. Like, why don't we all work together?
Yeah.
And that's kind of where my dream and aspirations of bridging the gap between Eastern and Western medicine kind of came together.
It's amazing. So I did take a look at we talked before this, and you actually went to acupuncture school in China. Is that correct?
Yes, yes. So
Okay.
I did my bachelor's of health science in Minnesota, and then I went to Northwestern Health Sciences University for my master's degree in Chinese medicine, and then went for advanced training in Tianjin, China.
How was that? And how long were you there for?
Oh my gosh, it was amazing. It was just incredible. And
Oh
so
my
we took
goodness.
most of our education here in the US. And then we went to China for clinical experience, exams.
Mm.
So we were there for about 6 weeks.
Okay, okay. Wow. Now, being in China and essentially doing your clinicals at a place that's, one of the sources, one of the
Yes.
major sources of Eastern medicine, what did you get anything from it that you think maybe you wouldn't have gotten had you done your clinicals in the States?
Yes. The one thing that I think is also just really helped broaden my perspective and horizons was in China, when you go to the hospital or you go to the doctor's office, that you kind of in a sense go before like a board. You
Mm,
tell them the complaint, and then these collaborative sources of doctors decide if you're going to go into Western medicine or Eastern medicine. And there is where I started realizing and seeing how much Western medicine and Eastern medicine were being used together in China.
mm,
It was amazing. Like they do acupuncture for sedation before surgery.
mm.
They do acupuncture for epidurals for labor and delivery.
Labor. Wow.
And so
Wow.
that I think probably was one of the most eye-opening moments for me where I thought, gosh, here's where this amazing medicine has originated. And they've embraced
Mm-hmm.
Eastern and Western medicine. So why aren't we doing it?
Yeah, yeah, yeah. It's definitely great to see the collaboration because we definitely have that division in a lot of field, but speaking of the healthcare field wherein it's like this is what I do, this is the best way to treat this, you know, disease or what have you, and the other person is like, well, this is the best way to do it, and 9 times out of 10, as you've noted, they're both right in one way or the other, right? And a lot
Yeah.
of time we've noticed that we are stronger together than apart. So
Oh,
if that's true in
absolutely.
life, why not in medicine, right?
I totally agree. That's it. I mean, let's be honest. We always say it takes a village. It certainly does. And some patients, they need a lot of village members to help them out.
Absolutely. So now that you're here, what demographic of patients does your practice see?
So for me, I have gravitated actually more towards like pain and neurology symptoms.
Mm-hmm.
I have just found this beautiful, wonderful, fun knack for helping people like with pain. I'll say like my own little like claim to fame in our little area is treating sciatica.
Mm,
It's one of those conditions that is really hard for Western medicine and even chiropractic care to treat because there's just so many different variables. It could be
mm-hmm.
musculature, it could be structural, it could be it's so many different things. And so I ended up having sciatica due to a back injury. Long story short, I used myself as a guinea pig, and I took the collaborative efforts of a few different Chinese medical practitioners that I've learned and put it
Mm-hmm.
together. And it was like, oh, this really works. Like, this is great.
I love
And
it.
yeah, so I would say probably most that I treat is pain and like neuropathy, whether it's from chemotherapy, diabetes, back injury,
Mm-hmm.
unspecified, that kind of thing.
Mm-hmm.
So
Mm-hmm.
yeah, it's not where I thought I was gonna be, but I really enjoy and love what I do.
I love to hear it. And what are how would you describe an acupuncturist to somebody who is not maybe familiar with the profession?
Sure. So kind of like in a sense, like what we first tell our patients, or even like we do some educational conversations with healthcare providers so that they can understand how Chinese medicine works. Because it's not woo woo, it's not magic. It really is the body healing itself. So basically, we have 14 meridians, and you can think of these meridians like a highway system.
Mm-hmm.
And then the chi that flows through our meridians is like the flow of traffic. And whether it's illness, disease, injury, what have you, somewhere in the body there ends up like to be a traffic jam.
Mm-hmm.
So let's just take something like sciatica. There's a traffic jam and it's causing pain. So we use specific points in the body to help with turning on the green light to get the traffic moving.
Mm-hmm.
So acupuncture, in a sense, helps to remove blockages, improve circulation, decrease inflammation, decrease different neurological firings that are going on that are creating and supporting these conditions,
Mm-hmm.
and then help redirect the traffic so that the body then can heal.
Mm-hmm. Mm-hmm. I love
And
it.
yeah, and it really is. I mean, that's the one thing that's the beautiful thing about Chinese medicine is we're not 100% sure how the body's going to heal. So by working on the condition or the main complaint, we then just allow the body to unfold and heal the way it needs to.
Mm-hmm.
So the patient's sleep might get better first before their sciatica gets better.
Mm-hmm.
And so it's just little different things like that that we are like, well, you know what? This is what your body needed first so that this can heal. And then
Mm-hmm.
hopefully you won't have a reoccurrence.
Yeah, yeah. And what have you noticed are some challenges in your field, if any?
Like I would say the top challenge is research. There's not a lot of research. There's research in the UK and there's some research in China. However, in the US, that kind of research isn't necessarily regarded as, doesn't have a lot of merit behind it.
Mm-hmm. Mm-hmm.
And also too, because with acupuncture, you actually have to physically put the acupuncture needle in. And already right there, if you're trying to do a blind study, it's already compromised. I will say that there is some wonderful evidence-based medicine that is coming out about acupuncture and Chinese medicine. However, again, it's one of those things that is very hard to prove.
Mm-hmm.
And then I would say the other thing that we find challenging is Chinese medicine is wonderful, but it's not always fast.
Yeah, yeah. And even with Western ways of treating, patients too, depending on the conditions, we as we both know, however long it took you to get there, whether it's back pain from, you not positioning yourself right, which most of us do because of the life we live.
Right? Yeah.
Especially us healthcare providers.
Makes me want to shift how I'm sitting.
I know. I know. Or it's diabetes or obesity or high blood, whatever it is that we're trying to treat. A lot of time, if it's not an acute situation, it's likely going to take time to get rid of, to properly treat. So however long it took you to get there, you're going to need about the same amount to get back to normalcy, right?
Absolutely.
So if you can do it with a combination of both, which will likely give you a better outcome. And
Absolutely.
if you follow the guidelines of the professionals, then maybe get to a point where you're not going back to.
Absolutely. Absolutely.
But yeah, we are very impatient.
Yes.
And I
yes, we are. We've come to the
patient. And sometimes us providers are like the worst patients.
No. We're like, I know this works. Why isn't this working? What's going on?
Yeah, and we're like, oh yeah, I'm getting like 4 hours of sleep because I gotta go, but I am still expecting my inflammation to go down. Like, you're on 5 cups of coffee a day. Are you sure?
Yeah. I'm not stressed. What are you talking about? Life is great. I haven't slept in 5 years. It's fine.
Right, let's go. I have lives to save.
Yeah, I got so much done today.
Oh my goodness. Now, how have you find any stress at all, and what do you do to cope with that, especially being in your setting and working with the combination of Western and Eastern medicine?
So I was without a doubt, because when you are working with people, I mean, healthcare professionals went into healthcare because they care. I would venture to guess most of us that went into healthcare is because we know that the body has the ability to heal and we want to help improve the quality of life of our patients. I guess like for me, when I feel stressed, if a patient isn't getting better or I'm not able to help, or a patient doesn't come back because they're not getting the results they want or need, I do really work hard to remind myself, I don't know what that patient is doing outside of my care. I don't know what their life is like. outside of my care. And I have to keep reminding myself, I'm just a conduit of healthcare. They're getting better or not getting better is not personal.
Mm-hmm.
And that is one thing that I work on every day when I leave. I'm like, I did the best I could with everything that I had today. And then I guess also too is really making sure that I walk the walk and the talk the talk. So I make sure that I do acupuncture. If I'm in pain, I do my physical therapy. If my physical therapy isn't working, then I go back to my therapist, or I go back to my chiropractor, or I go back to my doctor, or I go back to Reiki. I will make sure that I use this modalities that I tell my patients to use for myself, so that I keep myself in as best health as possible. And I have like a wonderful team that I work with that I will add, I'll be like, something's up, like, and so we'll take care of each other, or we'll recommend something for each other. As well as I really do, it's really important to me, like, time off, like just taking time to like enjoy life, like waking up and saying, if today's my last day, how do I want it to look? What do I want to do?
Yeah.
How do I want it to be? Who do I want to be? How do I want to show up? So I think that for me is like probably the most important thing, is just taking care of myself, so that as I do take care of others, I'm showing up the best I can.
Yeah. That is definitely the best thing you can do.
Yes.
Any growth and leadership opportunities as a chiropractor? And I know you have your own practice. So that's definitely, the one of the pedicles. But if you didn't have your own practice,
Yep.
or for people who necessarily are not interested in opening their own practice
Yeah.
and are chiropractors, what are some options for growth and leadership opportunities?
Well, I would say without a doubt, like just even supporting the profession by reaching out to other healthcare providers. I mean, we can definitely like have a leadership. It doesn't necessarily have to be like in a business ownership piece of it, but it can be in education for your patients. It can be educating other healthcare providers in what you do and how they may want to, refer patients and why they would want to refer patients. Even just showing up in the aspect of like your community, and supporting your community, and the fact of like, hey, health is important, because we're taught to save for retirement, like save your finances, right? Who teaches us to save our health? That you could take that anywhere. I mean,
Yeah.
from young children to, I mean, your people at church, like, hey, how are you? I mean, just being that caring person and just helping people understand, if you have back pain, guess what? Back pain's not normal. Back pain is your body's way of saying, shoot, something's not right here. And I think just even having that little bit, I mean, you could have an easy conversation at somebody at the market. That could be some kind of foundational leadership for them to then take a step into just even making their health a priority.
I love it. And do you, especially at this point in your career, a decade or so into it, how do you maintain and keep your education and knowledge up to date?
So I love learning. So for me, it's important to, one, obviously stay in my lane. I love learning about acupuncture and Chinese medicine. I have some incredible doctors that I just love learning from. But then for me, it's also about personal growth. So learning how to better communicate, learning how to be a better listener, understanding about kind of like what different conditions are and how they affect people. I think we've all, been dealing with the coronavirus, and just understanding that some people are on one side of the street about coronavirus, somebody else is on the other side of the street, and just learning how to be just kind of basically, in a sense, just like stand in the middle and just allow people to have their opinions and thoughts, and then allowing that not to then become personal or affect you. I think is very important, and to make that treatment, that space, that conversation safe for the patient. That was a very interesting tool that I've learned, because people they take their opinions very personally. Their personal
Yeah.
opinions are going to affect their health.
Yeah.
So
Yeah.
how do I then listen to them, appreciate what they have to say, and then comprehend how that may be affecting them, and then treat them accordingly? So our education and growth, I think, is obviously in our modality in which we've, decided to take healthcare in, but it's also about how are we talking and working and just being supportive to our patients and allowing them just to be who they are in that moment, and not like just taking that step back and not allowing, like, my opinion, it's got to stay outside.
Yeah. Yeah. That's definitely been a lesson learned with this whole COVID thing, where regardless of where you stand, it's like you said, it's very strong either way. And if you are not in a situation where you're able to have the conversation, you listen to what they're saying, whether you agree with it or not go too deep either way, because you never know what's on the other side, and still do the professional job, and and move on to the next thing. Otherwise, it's like you can easily find yourself in a rabbit hole, and you're like, oh sure, how did I get here?
Yes, you can. And then like you get yourself, and then it's so hard to like back yourself out, where you're like, oh geez, like I thought we were on the same page, but we're not. Oh boy.
Yeah. So
I don't want
to
add to your issues. Oh my gosh.
Exactly. So a lot of time is just like listening and be like, I can see that. I can understand that. Yeah.
Yep.
Okay. And
yes,
get into the meat and butter. Yeah.
And then to hopefully swiftly move past it and be like, okay, I acknowledge that. I understand that. Let's hear more about what's going on with you.
Yep. It's an art. It's definitely an art.
Yes, it is. For sure.
An art for sure.
Yes.
Oh my goodness. So I want to get a better idea of what a consultation is like for you, between you and a patient. So when a patient comes in, say especially a new patient is referred to you, and they're coming with their chief complaint or the main reason they're there, what is the steps are you taking? Obviously you're taking history. I'm imagining it's much the same as what we are doing in the doctor's office. And can you sort of walk us through that a little bit?
So when a patient comes in, they fill out just a regular, health history form. We want to know everything about, whatever you got going on. So even if the patient comes in, again, like let's just say like they come in for shoulder pain, we're still going to ask them a gamut of questions, because in Chinese medicine, the shoulder pain happened because there was some sort of blockage, deficiency, excess, whatever, somewhere that allowed for that area to be vulnerable to injury. So we're going to ask them, how's your sleep? How's your mood? How's your digestion? How we're going to ask them everything, and we explain to the patient, like, if you have this kind of pain, the meridians that run through that area govern over the liver, govern over irritation, govern over eyes, muscles, free course of energy. So we're going to ask about digestion, because if your digestion's slow, that helps us understand why there's a little bit of a traffic jam here. So we ask about not only what the condition is, but we need to figure out what other contributing factors and meridians are involved. So like, just for instance, if a patient comes in with hot flashes, we're going to ask them, okay, how's your sleep? Any dry eyes, hair, how's that? Any anxiety? How's your dreams? And then we get to the point where we want to figure out, how are the hot flashes affecting other meridians? And then a couple of the other diagnostic tools that we use is we look at the patient's tongue. So the tongue has a map of all the meridians. So the size, shape, color, texture, if there's teeth marks, no teeth marks, if it's moist, if it's dry, if there's a coat, no coat, all of that is going to help us understand what's going on in the meridians when it comes to the aspect of like yin and yang. And then we'll be able to better understand, are there hot flashes coming from a hormonal aspect? Are there hot flashes coming because they have adrenal fatigue? They're getting adrenaline rushes, which then are creating anxiety, which then is creating hot flashes.
Mm-hmm.
Are the hot flashes coming because of a shui deficiency? So we could have 3 patients that come in with similar conditions, but they all have different diagnoses, and those diagnoses are coming from different meridians.
Mm.
And then we also feel the pulses. So we feel the pulses, we use 3 fingers, use the index finger, the middle finger, and the ring finger.
Mm-hmm.
Each position of the finger represents 2 different meridians. That will help us then understand how the flow of chi is moving those meridians. Is it fast? Is it slow? Is it deep? Is it weak? Is it surface? And that again just helps us go, okay, this meridian is deficient, this meridian is excess, this meridian has a yin deficiency, this meridian has a yang deficiency. And those tools help us then also come up with an idea of like what kind of herbal formula we may want to then incorporate to the treatment plan.
Mm-hmm. Mm-hmm. Okay. And then once you have a plan for the patient, are you usually doing a couple visits with them, depending, of course, on the reason they're there and how complex the situation is?
Yes. So kind of like what I tell patients, because most of us understand physical therapy.
Mm-hmm.
So you're going to go see your physical therapist a couple times a week for the first few weeks, going to do all your exercises at home, right?
Mm-hmm.
Then you're going to spread it out to once a week and then bi-weekly. So we kind of follow the same students where it's like, we're going to see you a couple times for the first couple of weeks, because we need to see the rate of response your body has to acupuncture, because every body is different and every body is going to, respond differently. And again, that brings us back to I don't know what the patient's doing outside of my care. So if they're not eating or sleeping or exercising too much or whatever, that's going to contribute to how their body responds. So after the first 2 or 3 weeks, we just kind of do like a reassessment. And I found asking the patients to measure backwards. So we go back to, here's your main complaint and here's what you felt like. What changes have you noticed?
Mm-hmm.
I don't ask them how you feel. Is it better? Because when we ask patients if they're better, they're going to say no. Mm-hmm. Because if they're still having any bit of the symptoms, they're not better.
Yeah.
So helping them understand the progress that they made is very important, because that's going to give them those tools of like, oh gosh, actually I was having hot flashes every night. Now it's every other night, or I'm actually not having night sweats. So it's just kind of flushes. I don't have to change my clothes, that kind of thing. Now, if a patient isn't noticing changes within like the first 10 treatments, that's where I'm going to be the first person to say, okay, we're going to look into this, because within 10 treatments, we should see some kind of change. And then if we're not seeing much change, that's what we'll kind of do, like a little bit more of a deep dive into what their life is like at home, at work, that kind of thing. And then that's where we also then start pulling in some collaborative care and support for the patient.
Okay. And how long was your education overall?
So, your 4 years, bachelor's, and then master's degree. Here in Minnesota, they've now changed the Chinese medicine from a master's degree to a doctorate program. So now anyone that is graduating here in Minnesota from, and I think it's throughout the US, anyone that's graduating from, I believe 2019 on, is a doctorate program.
Okay. So that you can go into that with so you had yours as a master. So right now you're practicing that with the master's degree, but then they're doing that thing where like in many professions where they're switching.
Yep. Of course. Yeah.
I see no profession is left behind on that regard. So, it's like there's no point.
Absolutely.
Okay, I see.
And I get the flyers in the mail all the time. Would you like to, get your doctorate? It's like,
Uh-huh. What does that even look like for you, since you've already had the education and have essentially went as far as you could at that
yep,
time?
yep.
So what would there be? Do they have like 1 year like master's to doctorate program type of situation?
I believe so. I believe that it would be another 3 trimesters, which
Uh-huh.
probably equates to about a year, another
Mm-hmm.
year of schooling, and then one more board exam.
Okay. Yeah. And you're like, I'm good.
If I wasn't if I didn't have a busy practice,
Yeah.
and I'm fortunate right now, like my children are grown and gone. They're 22 and 29, so they're
Oh,
off living life, loving it.
yeah. Yeah.
But I just, at this point, I'm like, gosh, it my years of experience have just given me such a wonderful knowledge base and practice that I guess if I felt like I needed probably to further the education piece, I would.
Yeah.
At this moment, I just don't see that I need that. I do
Yeah.
my continuing ed as I love doing, but I just don't feel that I need to go back for it right now.
Yeah, no, that's totally justified. That's
Yeah.
totally justified. And last question before I let you go.
Mhm.
Any word of advice for future acupuncturists, or especially those wanting to do Eastern medicine and perhaps do something like you're doing and really bridge the gap between Western and Eastern medicine?
Yeah, I would say without a doubt, please go into Chinese medicine. We need to grow the profession. It is
Mm-hmm.
a beautiful medicine. It collaborates incredibly with so many other therapies and medicines. And I would say take your time, pick your school,
Mm-hmm.
enjoy the medicine, love the ride, and then when you do graduate, find a doctor or practitioner that you can follow and that is willing to mentor you.
Mm-hmm.
There's so many different, as I'm sure in every area of medicine, experience is the most incredible knowledge.
Mm-hmm.
And having that mentor or that person to help support you through school and once you graduate just really definitely can make the difference for you. So find a mentor. If you need help finding a mentor wherever you are, I'd be happy to help you.
Mm-hmm.
But just having that support system and knowledge is just priceless.
I feel that. Well, thank you so much, Nikki, for taking the time. I know it's even later where you are. So
Well,
I
this is
appreciate
great.
that.
I was thrilled to meet you. I've so enjoyed your podcast. I so love what you're doing, and thank you so much for just spreading the education and just bringing awareness to all different types of collaborative medicine. I mean, we can, together we can help more and more people.
Amen to that. And thank you for joining. I appreciate you listening. I really do love hearing my guests and people I admire and love what they're doing, taking the time and listening to my little podcast. So I'm like, oh, thank you.
I love it. I love it.
All right, Nikki, thank you again for joining. I'm
you.
excited to share this with the listeners, and you have a beautiful evening.
You as well. Take care of you. Thank you.
Thank you. All right.
Oh,
Bye.
bye.
Okay, and the answer is true. Acupuncture is oftentimes utilized in Western society as a treatment, but it can be used as a preventative. And you get to sort of hear about some of that in this episode, and also in the next episodes we have with the acupuncturist joining us. I hope you all enjoyed this episode. All right, that's all I have for you today. Thank you again for joining me. I appreciate you. Please subscribe, follow, like, comment, and share. And stay blessed. Bye.